Welcome everyone to the February 6, 2023 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gustowski-Gobin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn, present.
Bill Muller.
Bill Muller here.
And Jennifer Maynard.
Maynard, present.
All right, and then staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. I see Micah Blondeau.
Present.
And then I see Amelia Houghton. It looks like you might be on mute still, Amelia. Let me just get back to my notes. All right. I'd like to open the meeting. Can I get a motion to open the meeting?
Yep, this is Dan Finn. I'd like to make a motion to open the meeting.
Is there a second?
This is Bill Muller. I'll second that motion.
All right, and then board members, roll call vote.
Dan Finn, aye.
Bill Muller, aye.
Jen Maynard, aye.
Karen Gustowski-Gobin, aye. All right, good evening once again, everyone. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the act extending certain COVID-19 measures adopted during the state of emergency in Massachusetts. This act includes an extension currently until March 31st of 2023 of the remote meeting provisions of former Governor Baker now, March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. For this meeting, the Grafton Board of Health is convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you, and take care not to screen share your computer, because as we all know by now, anything you broadcast could be captured by said recording. Any supporting materials that have been provided to the members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Just briefly before we turn to the first item on the agenda, just allow me to cover a few basic ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. Any speakers for any topics on the agenda, I will introduce them. And then after they've concluded their remarks, I'll invite the board members if they have any comments, questions, any types of motions. As always, please identify yourself before speaking. Please remember to mute your phone or computer when you're not speaking, to reduce any background noise, and then please remember to speak clearly and in a way that helps generate accurate meeting minutes. For any response, please wait until I yield the floor to you and state your name before speaking. And then finally, any votes on any motions that are made during this meeting will be conducted by roll call vote. All right. See Amelia.
Can you hear me?
Now we can.
Oh, geez, sorry.
That's okay.
I don't know what is happening. I apologize for that.
No
The
worries. I
video
know
isn't
there was
working.
all sorts of crazy updates they did with our work computers over the weekend and like early this morning, and people were having all sorts of issues. So nothing surprises me after what I've been hearing about today. So not a problem.
I'm here, I promise.
We saw you, so we figured that's why I didn't dwell on it too long. So all right, so with that, the first topic on the agenda is the Alliance update. So Micah, Amelia, who wants to kick it off?
Okay, so Micah, do you want to start?
Sure, I can start. I just have a couple updates from Solo that we've submitted the new IMA budget to the town manager. And they're going to be following up with the town manager to develop a new 5-year IMA agreement. As well as we just submitted the annual report. And then as far as my inspections go, I did, I believe, 13 regular food inspections. We had one person who ate at Pearl Cafe who suspected they had gotten food poisoning. I went and did a full inspection and couldn't really find anything to link those two together. Then we also just had a complaint of some trash being left outside. And we're working with the homeowner on that one. And I think that's all the updates I have. If anybody has any questions for me.
Dan?
Yeah, thanks, Micah. 2 questions. There was a fire at a facility up on Creeper Hill Road. Did you see anything after that or get called in to check that out at all?
What facility was that?
Feedback Earth, which is technically governed, regulated by the state, not by the
Oh,
town.
that's right. Oh, that's right. Okay.
Yes, so I actually was unaware of that.
Yeah.
Yeah, it was a good size fire coming out of the roof out of some of the stacks.
Wow, okay.
I
Yeah,
mean,
they
they
said it-
managed to contain it enough, but it sounds like definitely some of the equipment got some pretty bad damage to it and stuff.
Yeah. And hopefully any,
I mean, there were no
And-
injuries, obviously, thankfully, that's always the most important thing.
Yeah.
Yeah, they had put a lot of fancy equipment in there to manage these smells, so we'll probably have to be checking in with them as far as how that goes. But they're managed by the state, so I'll probably go to them first and
Yeah.
see if I'm needed at all.
yeah. And then secondly, I'm just wondering on the list of inspections, the children's daycare and preschool, is that the one at the bottom of Bruce Street or one on Keith Hill Road at the old Keith Hill Nursing Home?
Let's see
It's
here.
Grafton's Children's Daycare.
That's at Old Westboro Road.
Oh, okay.
Well, that's the one I went to. Of course, it's changed hands. That's the one I went to way back in the day.
It's still around. Okay.
Yep.
Yes.
Not the same owners anymore, I can guarantee.
Yeah, that's all I was wondering about. Thanks.
Yep.
All right. Any other questions for Micah on the inspections or anything? Anyone else? All right, Amelia, anything that you want to
Okay.
go over with us?
Yes, so let me give you a little update from the community health team first, okay? Since they've had new staff. Okay, members of the community health team, along with Director Dennis, met with central office administrators from the Grafton Public Schools, as well as school administrators on January 19th, in order to discuss ways to expand the existing partnership between the school district and Worcester Department of Public Health. So topics were discussed, which included health, mental health, and substance use. So that's in the works. Since then, 3 new members have joined the Worcester Department of Public Health Community Health Team. Okay. The first person was Emil Somda, MD, MPH candidate. He is our new maternal and child health coordinator, new position. He also worked as a mental health counselor in treatment and recovery center. He's fluent in French and 2 other languages. He's a practicing physician from West Africa, where he coordinated new mother breastfeeding committees counseled new mothers on breastfeeding and sudden infant death syndrome, and was involved in community-based organizations to educate community on sexual health and infectious disease prevention. So those are some things he will be working on with our team. We also have another prevention specialist, Engel Torres, and she's a graduate from Worcester State University's Public Health major program. So she's also fluent in Spanish, and she will be working with the team. Her role is still being mapped out, but she's looking forward to incorporating her skills into helping out the community health team. They have another vaccination educator, Emily Flavin, who has her master's in public health. So she too is working with community health chief Brendan Keenan and team, helping out our clinics. She participates in our mobile clinics in both data entry and helping to educate the clients. So all of that is underway. That's the community health team. Data research and epidemiology team. They provide weekly COVID-19 and vaccination data reports. The written reports of the 2021 Regional Youth Health Survey for Grafton High School and middle schools were submitted to the superintendent and are being used to inform school initiatives and programs. And the office has also updated Grafton's communicable disease report for calendar year 2022. I know you're interested in the COVID information. The year 2022, there were between January and June, there were over 1,400 confirmed COVID cases in Grafton. And between July and December of 2022, there were 437. So that did go down as the vaccination rate went up. And on that note, I will be looking to schedule COVID vaccine clinics in Grafton between February and March. And this is to take advantage of the state's incentive. They have a gift card incentive. So as you know or may not know, the clinic scheduled in Worcester, they give out $75 gift cards to those populations who go to these clinics and get a vaccine. Per the state, certain towns are allowed to give out $25 gift cards. Grafton is one of those towns. So in order to take advantage of this, because the incentive may go away towards the end of March, they may extend it, but it may go away. I would like to host clinics in Grafton, either the schools or perhaps the senior center or central location. And we'll give you all more information as we plan that out. And I'll be talking to Nancy about that and the school nurses. Okay, so that's the COVID. More along the lines of the nursing piece. Our new nurse, Molly Scannell, held blood pressure clinics at the Grafton Senior Center, and Housing Authority. Blood pressure clinics were held in April, May, June, July, August. Molly, our new nurse, took over October, November, December. And in January, she goes once a month to the Housing Authority, once a month to the Senior Center. Unless there is greater need, we keep it to once a month. So she and I have also been to Grafton Schools on October 26th at the high school and November 17 at the Millbury Street School. And we provided flu vaccines for students. We also, on December 1st, held a COVID clinic for students and families in the Grafton Middle School gym. Now, since that date was during the state incentive program timeframe, I was able to get those recipients a $25 gift card for receiving the vaccine. Okay, tuberculosis. So this number I'm going to give you does not mean that we worked on this number of cases, doing case investigations. This is for last year, 2022. There were 32 confirmed TB cases. We did not, actually, for the town of Grafton, did not work on any last year. There were no direct observation therapy cases. 32 comes from the state in that it includes all cases, whether or not they require attention from the local Board of Health or not. Some of these cases, the state takes care of them, the state EPIs, or the state TB nurse. And it's maybe a phone call, or it's maybe, do you want treatment, yes or no? Or their contacts and nothing further is required. So it's a low number comparative to other towns. But like I say, we did not work on any Grafton direct observation therapy cases requiring case management. Grafton did not have any confirmed monkeypox cases either. And one of our team members does help APW AIDS Project Worcester in Worcester to administer monkeypox vaccines. So we do participate in that, and that's in coordination with UMass. Okay. Now I can tell you, just as a side note, last year they gave over 600 monkeypox vaccinations in Worcester. Okay. Right. Micah, you talked about the tobacco inspections.
I actually did not cover those.
Okay. Is that something you want to do? Otherwise, I have the information in front of me.
Yeah, if you just want to go over that, that'd be fine.
Okay. So this is for 2022, the tobacco control summary. So number of inspections for retail tobacco educations, 10. Number of inspections for enforcement inspections, 2. Number of inspections for retail tobacco violations, 1 verbal educational warning given, It was to change the single cigar prices to $2.90. Youth access compliance inspections, 0. Youth access compliance violations, 0. Total tobacco inspections, 12. Okay. So that's it for community health and tobacco and nursing. And like I say, creating COVID clinics for Grafton is on tap for the nursing team. As well as communicating with the senior center to see what other needs are for the senior population. Maybe trainings, education, maybe come up with a survey on what their needs are. So that's all in the works. I'll have a lot more information next month.
Thank you. Oh, Dan, question?
Yeah,
Comment?
thanks, Amelia. I'm just wondering, in the beginning of your presentation,
You went on mute, Dan.
Oh, sorry, I lost you.
here we go. Thank you. In the beginning of your presentation, you spoke about the different couple of teams, the community outreach or health team, and are those teams part of the alliance, or are they just sort of collaborators from the city of Worcester?
Oh, so like our department, the Worcester Department of Public Health has, as you know, an environmental health team, a community health team.
Yeah.
And those people are part of our community health team
Okay,
and involved in the alliance. All our teams are involved in the alliance.
are they paid directly through the, does the alliance direct them?
To work with Grafton, you mean?
Yeah,
Yes, I believe it was Brendan who, hang on a second, let me find the statement. Yes, it was members of that team who met with the central office administrators from the Grafton Public Schools.
Yeah.
So all our teams are involved.
okay, thanks.
And there are lots of new people, so there will be new ideas coming out of this.
Thank you.
I just had a quick question to piggyback on your last statement about the senior center checking in on needs. You mentioned about the blood pressure clinics being monthly unless there's a greater need. Is there, like a certain volume of attendance that that you make that decision to add more than monthly, or how is that determined?
Well, so far, we average, and we've been averaging anywhere from 15 to about 22, 23 people in the hour and a half that she's there.
That's pretty good.
And when I used to do it, that was about, 22 was the average. And I know they have other people coming to do blood pressure clinics. But we will get together with the senior center staff to see if there is some other way we can help out or participate. I know I used to do hands-only CPR training. That was well received. So we'll revisit that. And maybe not just for the seniors, but maybe that could be a place where community members could come. I know they have a big gym there. That could be an event for the public there. So, we have a few ideas that we want to discuss with them.
Great. And I know the senior housing folks, I'm not sure about Grafton, but some of the other communities in the area, in particular, like if they used to have folks other than the Board of Health or people that work with the Board of Health going in to do things like clinics and any kind of wellness programming, there's not a lot of capacity in the communities right now to bring those in. So to your point, beyond the senior center, if the senior housings, find a need for additional, that might be something to evaluate. Because I know a lot of like I said, the agencies that used to go in they don't really have the capacity to do those things anymore.
Right, and when we go to the housing authority, it's not well attended, but the few that take advantage, it's worth it to keep going there. Because they know about it, it's posted, and it's posted on the bulletin boards there,
Yeah,
and they don't have to walk to it, they're right there.
exactly. Yeah, it depends on how much they, are able to communicate with residents too, to kind of bolster attendance. That seems to be a theme in most communities.
Right, and we are trying to figure out what's not a better way, but maybe a different way to provide this service to the housing authority.
Right.
Because there may not be, there may be residents that can't walk to the next building over.
Right.
But maybe they could go down the stairs or elevator to their lobby, that sort of thing.
Yeah, absolutely. And they all have kind of varying degrees of their own staff that are connected with the residents, but that's great. Thank you.
Yeah, no, we are looking into that. I feel like it's not enough just to be there 1 hour and a half in one building when it's a huge complex. So yes, more on that later.
Bill, I see your hand, your virtual hand.
Yeah, I've never put up my hand before.
I'm just like, oh, wait, there's a little virtual hand over there.
No, thank you. I have a couple of questions, Amelia, about the demographics of the statistics you have on tuberculosis screening.
Yes.
Are these routine Mantoux tests that are known to be conversions from previous negative tests? I mean, who are these people who are presenting with positive tests?
It could be people that have just moved to the area and they were previous positive and had a medical evaluation and blood work, and that was found to be positive. It could be old disease. These particular cases, like we don't get any information from the state because there's nothing we need to do with them. So it's usually old disease that's been taken care of, possible positive TST, and they follow up with their own providers, and the providers may report it to the state. Not all TB type cases need to go through the local Board of Health.
Yeah, I mean, I think the only question I'd have is if someone is known to be a converter, to have had a negative Mantoux test a year ago and now has a positive Mantoux test, that has a much more clinically significant,
Oh, they would be referred.
implication. Yeah,
Yeah, they would be referred to the clinic that we use, which is at UMass Infectious
Right,
Disease Clinic.
right,
They would then become a part of our TB program.
right. Okay, well, that's.
I mean,
fine.
I just gave you that number just because it's from the state, okay? But we had no latent TB, we had no direct observation therapy cases, which would be confirmed disease state case in Grafton last year.
And no people who were put on INH prophylaxis.
Not from us, no.
Okay,
It could also be people that had started therapy and moved to the area.
right. Okay, well, thank you.
Okay.
Any other questions for either Amelia or Micah before we jump to our next topic? All right, seeing no real hands, virtual hands raised, or people going off mute, I'm going to take that as there are no further questions. Well, thank you both for your reporting. We really appreciate it. And keeping us up to date and kind of giving us that summary as we've, rounded now. We're somehow already in early February. Doesn't
Yeah.
seem real. All right, COVID-19 cases, vaccines, and mitigation efforts. All right, latest reporting as of February 3rd, Grafton has been informed of a total of 4,111 confirmed positive COVID-19 cases back since we started tracking in early 2020. As we all know by now, there's a high likelihood there's a variety more cases that are out there happening as we speak that aren't getting reported. I'm sure that hasn't stopped. And I think it looked like, looking back the past couple of weeks, that kind of spike that we saw and had expected kind of following the holidays that we had talked about at our last meeting, which was kind of on the early January side, has started to come down. I think this last week it was 10 reported. So we've kind of come back down, not to single digits, but definitely not at the higher number that we had seen following the holidays. Which is good. And I will say there's probably less people testing themselves and not reporting right now because you're not having the holiday gatherings where people are testing before they get together or testing after they've gotten together. So it goes to speak to the fact that there's still, I'm sure, a variety of cases that we're not getting reported on. There's also still variety and higher levels of flu. I know RSV is still out there, but it seems not to be as hot of a topic as it was earlier on in the winter, which I would say obviously is a good thing, but still there's a lot going around. A bunch of people that have, whether it be COVID, flu, other, that isn't just the common cold. So definitely everyone, still stay aware, take precautions, wear a mask, especially if you're indoors around, or have family members that are immunocompromised, elderly, etc. Definitely still a lot of viruses going around that can impact folks in a variety of ways. And there's still a bunch of people that are hospitalized with various flu-like, COVID, etc. illnesses. Vaccines are still available. The latest information is in the same locations as previously, whether it be the CDC site or the Massachusetts site, are the best locations to find the information, especially if you're looking for a booster, to figure out like what you've had previously, and then timing wise, following your initial series, etc. Let's see. I think that's really it at this point. I'm not calling it status quo, but it definitely seems to have at least calmed down a little bit compared to when we were talking in December and when we were talking right after the holidays in January. Any questions, comments from the board members? Anything else? Amelia, Micah? Oh, Bill, I saw you went.
Yeah.
Oh, hand off and unmute. Perfect.
Well, now that I found this new button, I'm gonna, I guess the only question I have is, do we have any other information of the 4,000 plus cases that have been recorded locally? Do we know how many of them required hospitalization? How many required ICU admission? How many deaths there have been? Do we have that granular type of information regarding this?
I know I've never seen anything to that minutia.
Yeah.
Yeah, I don't know that we would have that. I probably could talk to Dr. Hirsch to see how we could get that type of data. Our
I
medical
think if it
director.
existed, it would be of some interest. I
Yeah,
do think
agreed.
as a community, we have an excellent vaccination rate. So I would think that those numbers would be quite low.
Yeah, I would expect it to be like, it would have gone up, especially with like the original and the Delta
Sure.
before vaccines. And then as vaccines hit and you started to get, although maybe more contagious, but little less likely to cause severe illness with like say Omicron, et cetera, I would expect by that point, you've also had the vaccines into a larger population. You would hope that the ICU, the hospitalization, the death rates would have started to drop down over time.
Right, right. Well, I would think that it's probably fairly low to begin with.
Yeah.
But I think it would just be of some interest to see how we've done kind of comparing ourselves to similar communities.
Yeah, I will find that information out for you because I think it would be interesting.
Sure.
And also, VaxFinder, like you can go to VaxFinder to look for a particular vaccine for a particular clinic or city. That's still true. I have to update our VaxFinder weekly.
Okay.
So if somebody's looking for a vaccine, it's, let's say in Worcester, they type out the vaccine and it shows you the location of who has it. So that's the VaxFinder site.
Yeah, I know I've had people ask me like, well, what can I get? I had X on Y date, and I'm like, go to the CDC. I'm like, first, like, go, plug everything into like the CDC site or something. Like, I don't want to try to do it off of memory as to whether if you got the J&J back in the day, what's your best options and stuff and timing, because they changed it so much for a period of time where it seemed like it was always something was changing along the line. And then it's like where to go. And it's like I would point them towards VaxFinder, like depending on what you came up with for what option that person chose, whether they wanted Pfizer or Moderna or whatever. It's like, I don't know what people have in stock on any given day.
Right, exactly. And when you fill out those questions, it kind of guides you to, what you should get next. I mean, nowadays most of them are mix and match. But yes, they do need to confirm that.
Yeah, I'm like, I don't want to tell you, yeah, I'm pretty sure you can get X as of Y date and then like have crossed my wires because it all, changed recently and I hadn't personally looked. All right. And then I always say, and talk to your doctor if you have any questions. That was always the caveat.
And they say, talk to the Board of Health.
That wouldn't be the first time we've heard that come back. I can tell you, Nancy fielded many of those calls. Yeah. All right. If there's nothing else on that next topic, Grafton FEP rep. This is pretty much, I think, just a formality at this point that we have to, because of the changing of folks in the alliance with Colleen and everything. Now we have to make the kind of the standard practice, make a motion, a second, and a vote for who we want for the primary FEP rep, and then the same thing for the secondary rep. For background, I know Jen and Bill, I don't remember the last time we've done this. Typically, since we've had the alliance in our world for a partner, typically the primary FEP rep's been someone from the alliance, and then the secondary, at least as of late, has been Mr. Dan Finn. So pretty much we just have to, now that like Colleen is gone and they're asking for updated information. So I think we had aligned, Dan, correct me if I'm wrong, you were still okay with being secondary, and I think Amelia, you were fine with being the primary.
Yes.
Yep, that's fine with me being in a provisional or backup.
All right. So if that's the case, then we have to go through the formality. We need a motion for each one with a second. We'll just do it first, like primary first, motion second, then we'll do the roll call vote, and then the secondary motion second, roll call vote. That way we don't lump them together or anything. We'll follow pure protocol. All right. Is there a motion on, Dan?
Yep, I'd like to make a motion to appoint Amelia Houghton as the primary representative for FEP from Grafton.
There a second?
This is Bill Muller. I second that.
All right, and then roll call vote, board members.
Dan Finn, aye.
Bill Muller, aye.
Jen Maynard, I.
Karen Gwiazdowski Govan, aye. All right. And then is there a motion for Dan as the secondary?
This is Bill Muller. I make a motion to make Dan secondary representative.
All right, is there a second on the table for that?
Jen Maynard, I'll second that no motion.
All right, and then a roll call vote, members.
This is Bill Muller, aye.
Jen Maynard, I.
I think I abstain. Dan Finn, right?
You can abstain because there's enough of us, obviously. Karen Gwiazdowski Govan, aye. Well, thank you both. We appreciate it. I will let Nancy know because I know she has to submit a letter, which I already know she has drafted. So I will let her know. So then she can send that off. All right, next topic, rabies clinic. Dan, if you want to give us an update on where we stand on that.
Sure. Yeah, I've spoken with Joanna, who's the third year Tufts veterinary student. And she's connecting with the second year student who's her cohort in this project and her professor. And we're shooting for having a meeting at the Municipal Center on Wednesday, February 22nd at 10:30. And preliminarily to go over the parameters and put a plan together. We're still shooting for having the actual clinic on Saturday, April 1st. If we can secure room or the lobby or whatever at the Municipal Center. But it'd be nice if we can also get someone from the Alliance, I think, to come to this as well, just for their input, and anyone else at the Municipal Center that is interested in putting the whole thing together. So that was, I haven't discussed it with Nancy yet, so I'm sure she'd like to be there, and perhaps Beth works mornings. But it's Wednesday, the 22nd of February at 10:30.
And that's just the meeting to
Right.
discuss, not the actual clinic.
Correct, correct.
And then back in the day, because it's been some time since we've had one of these now, we would, I'm using the royal we on that. I wasn't the one personally doing all the coordination, but we, AKA the Health Department Board of Health, would coordinate with someone from the town clerk's office to have someone there at the same time. So that way folks who needed or wanted, anything to do with their dog license could kind of get like a 2-for-1 visit at the same time, especially since it was on a Saturday. So it was the ones I had attended, definitely they got some business at the town clerk's office also, just because there's, it's not that there's not any evening hours, but sometimes even that Tuesday till 7 o'clock doesn't cut it for some people to pop over to get to the town clerk's office. So I don't know if that's been discussed at all.
Yeah, not yet, but that's something we'll try to pull together at that meeting. And, probably have to have a maintenance person there as well to open the building and things like that.
Yeah.
Yes, they have to have their updated rabies vaccine to get a license. So like you said, 2-for-1, it's right there.
It was pretty much like you be like, okay, vaccine, take your record. And then not everyone had to go back there, but definitely they got some business. And it was pretty much like, go around the tables, they're right back there.
So that's it.
It'll be exciting to hopefully be able to offer that again. All right, last topic on the agenda was meetings via Zoom, and we put this on here because currently, if you listen to my little spiel at the beginning, currently we have through March 31st to be able to do purely Zoom only meetings. They could obviously extend it like they have in the past. We still have our March 6th meeting that we could take advantage of Zoom only. And I'm not saying we have to answer this now, but just putting a tickler out there for everyone that if it does not get extended for this provision at the state level, then after said March 6th meeting, so April on, we will either have to do in-person only or a hybrid in-person Zoom type of situation. Will no longer be permitted per open meeting law to just be on Zoom. So like I said, doesn't mean we need an answer today. Just wanted to put it out there that kind of like the last time, I think we kind of briefly mentioned it at the June meeting or the early July meeting, whatever, because it was supposed to end in sometime in July and then they extended it. But last time they extended it was like a week before our next meeting or something. So we shall see. And if it's the hybrid, because I know Nancy started to like secure meeting rooms and trying to figure out like how to do the hybrid thing from a meeting room perspective type situation, and then we didn't have to. So same thing, probably should start looking for a room for at least the April 3rd, and like the May 1st one, in case they don't extend it, and start talking to folks that do hybrid meetings already. So that way come April 3rd, we're not like, how do we do this? Do we have a room? No. Uh-oh, that's not good. All right, I didn't have anything for old or new business at this point. Nope, Dan?
Yeah, just one thing. Most of you probably already got the email that I forwarded about a drill tomorrow, the EDS drill. Did everybody get that today? An
I
email?
haven't checked email. I've been in meetings
Okay.
up until this, so I'm
So-
assuming I did.
Yeah, so tomorrow, Jamie Terry actually set it up, and I'm just forwarding it to the various people that are on the list. So if we had an actual operations activation, who we'd want to contact. So the drill tomorrow is actually a very quick thing of like 3 or 4 questions of if you are who you are, and if we have the correct email contact information, but also if you could respond at all and in what sort of time frame. I think there's 8 hours a day or 2, and I don't expect an EDS actual event to require anything really urgent. I would think it would be a day or 2 or 3 to get round up people. So anyway, if you could just keep an eye out tomorrow, it's going to come out about 7 or 7:30, and they're asking people to respond by 5 o'clock in the evening as to their availability, so to speak. So if you keep an eye out for that, that would be great.
Appreciate it, Dan. All right, so upcoming, there was no mail or correspondence. Upcoming meetings, we have March 6th, April 3rd, May 1st, and June 5th on the docket for now. So, all right, that's all we had. Dan,
Yes, I would like to make a motion to adjourn this meeting.
there a second?
This is Bill Muller. I'll second that.
All right, roll call vote, members.
Dan Finn, aye.
Bill Muller, aye.
Ben Maynard, aye.
All right, Karen Gwiazdowski, Govin, aye. All right, thank you, everyone.